Dira half teaspoon chokuchaya mushonga wacho mutange masheka-sheka so mugomurira. Sheka-sheka mushonga wacho mugomurisa. Mupei mushonga wacho, haufani kusvisvina, ngaaomedze. Mubate mina amedze mushonga. Ndakamborwara ndabva nhombo yanga ine 5 months.
I fell sick 5 months into my pregnancy. After I had had a miscarriage, I went to Dombo Clinic. At this point, I didn't know what was happening and was taken to Harare Hospital and put on a drip. When I felt better, I was asked to go for an HIV test, and I went to Dombo Clinic, was tested and found to be HIV positive.
Zama kuti murivo ndava mukasire kubika. Maonero atinoitwa nevanhu vanoona isusu sevanhu vasingaoni.
As people who are visually impaired and also HIV positive, the way that we are viewed by people who have sight is not very good. They view us as if we are not human beings or people who could possibly be infected with HIV. When we go to hospitals, they wonder how we could possibly be infected with HIV. Where would they get it from? But what they don't know is that we are people. A man of flesh is a man of flesh. The only handicap we have is that we don't see, but what everybody else desires, whatever their race, whether black or white, if I love a woman, then I love her, so I can contract HIV.
Masera sei.
Tasera, masera.
Malingwa yakadi mchimwa ma ARV.
Ndingangoti yatova mwedzi yakati kuti kuda kana tukwana gore.
Wave negore. Ko CD4 yako wapedzera tora rini?
Ndichazoti ndingoti mwedzi wapera.
Last month.
Dai muzvipatara izvi. Doctor kana nurse unenge achindibatsira.
In hospital, the doctor or nurse who's helping me should be in a position to tell me that since you're HIV positive, you drink the pills like this, explaining and also allowing me to fill the pills.
There is no access to communication in Zimbabwe. I think it's an issue of deliberately targeting persons with disability. Because I think we've done great HIV and AIDS prevention programs in Zimbabwe. I think we have one of the best programs in the SADC region. But because persons with disability have not been deliberately targeted, they've been left out of the loop.
The visually impaired are presumed to be sexually inactive, and they are viewed as children of God who may not get HIV and AIDS, because if HIV and AIDS, it comes through sexual exchanges. People out there assume the visually impaired don't indulge in sex.
Issues of disability from the time memorial has been neglected by many sectors of society, simply because people with disabilities are regarded as people that not have full potential to support or empower.
came across with these families when we were doing a baseline study exploring health equity for persons with disabilities in regards to access to HIV and AIDS services. So I met Mrs. Mambio and her husband. They were just on the street, playing guitar, begging. So when I introduced that to them, and I told them that we are doing a baseline study to see how persons with disabilities access HIV and AIDS services. And they actually disclosed themselves to say we are HIV positive ourselves.
The visually impaired is a typical example of disability in that communication is a barrier. So standard information around HIV and AIDS takes the form of posters, takes the form of pictures, takes the form of books, takes the form of leaflets. And when somebody is visually impaired, obviously a great deal of that information misses the visually impaired.
National programs are skewed in favor of the able-bodied. Unfortunately, the leadership of NAC, for example, is all able-bodied. The assumption being those who are disabled, who contribute towards the AIDS levy, will be represented by someone else. But we're saying, allow the 1.2 million people in the country who are people with disabilities to be represented in national forums like that. Even when you go to the Ministry of Health, most of the issues there are spearheaded by the able-bodied. Look at the nursing training schools. Look at our medical school in the country. The diagnosis that has been happening by doctors, by nurses, who understands deaf language. The syllabus is disability shy. The schools that we have, for example, for the hearing impaired, go only up to Form 4. So if we are talking about ensuring that the hearing impaired access the education that we need, if education is an empowerment tool, then our government has dismally failed to provide education for the visually impaired and the hearing impaired.
Kufarira kubuda pachena kuti uri positive zvinhu zvakanaka zvinokonzera kuti uwane rubatsiro nepawanga usingafaniri kurwana unogona kutorwana nekuda kuti unenge wabuda pachena kuti uri positive.
I think the project in Airport is really an empowerment project. We want to empower them, remove them from the streets, let them actually have a life worth living. Because living off the streets, they are making themselves vulnerable to reinfection, and they are also putting their families at risk of contracting the virus.
We got involved with DAT after my wife was told that there is a program for people living with HIV. Our daughter is living positively with HIV, and that's how we got involved with DAT. My wife and I were tested. We were found to be negative, and we were requested to come back for further tests after 6 months.
16.
She is 16 years old. I think she got infected by the virus after she was forced to have sexual intercourse with someone who was positive.
Akabvuma kurara nemunhu ane chirwere ichi ndofungidzira ndokutora kwaakachiita.
Noe uyaka yandaridze basari uya zvondiratidza
I have 7 children. 3 of them go to school, 3 are older and out of school, and the other one, Nokutenda, is not yet in school. I was surviving from begging in town, sitting on the veranda. This is how I was raising money to look after my children. I'm now able to get food to eat. When I was begging on the streets, I wasn't getting enough food for my children. Now I'm also able to put my child in school, which is a thing I wasn't able to do before. He was always turned away from school. So when I received money from Dad, I paid school fees for my child, and we also got money to buy food for the home. So that helped us a bit. We received $500. The first thing I did was to get my husband an emergency travel document so that he can go out of the country to order some turkeys, which we took to the rural areas.
First of all, I want to thank Dad for this assistance. After getting the emergency travel documents, I traveled to Zambia. I was able to come back with the turkeys, and then we gave to relatives to sell for us. So I am so grateful because in all my life, I had never come across such assistance. I saw it for the first time through Dad, so I am very thankful.
As that organization, we are there to bridge the gap which is being left for people with disabilities. Mostly they are forgotten and they are not being catered for. When you talk about HIV and AIDS, many people with disabilities are forgotten because people, I think they have a belief that people with disabilities are asexual, yet it is not. I have a disability, I am deaf, and that has covered the gap by giving information to the deaf people through joining other organizations which work with the deaf in teaching the deaf youths on how to keep themselves safe and how to move on with life. And also they are working with the people who are blind with visual impairments. They do some interviews and find out what their problems are and how they can get information on HIV and AIDS.
We have got a memorandum of understanding that we signed between DAT and the Disability Resource Center of University of Zimbabwe. And in that memorandum, we have agreed that we will be working on HIV and AIDS in the production of material and also in counseling some students. That's the relationship that we have with that.
And our vision, more like a dream, a society free of HIV and AIDS and full inclusion of persons with disabilities. And our mission is to facilitate comprehensive rights-based initiatives for persons with disabilities in relation to issues of prevention, care and support mitigation. And we also facilitate rights-based empowerment programs.
Well, we're very happy to have DAT as a partner in some of the work we do, and we're keen to increase that partnership and work more closely together. Having a group that coordinates and speaks for people with disabilities in the sense that they give their input and they come together to discuss their specific needs for information or needs to be part of certain programs, that is a key component to the success of any campaign, and especially a health campaign.
I'm seeing the future of DAT to be very bright. And the future of DAT to be very bright based on a national and regional voice, whereby issues of disability will be championed through relevant structures that I'm sure we are working with as DAT. At national level, for example, we are working with various organizations for the visually impaired and for the hearing impaired, so on and so forth.
And we want to make sure that these people come together and present a one voice. In short, what we want to see is that in future wants to see that disabled people's organizations unite and work towards one goal, and also have their own representatives in parliament, their own representatives in councils, their own representatives at village level, so that they can champion their own destiny.